Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu! I'm Priya Padilla-Doleda from CDN Digital, together with the hospital at Maayo, and this is Maayong Adlaw Doc at its Season 2. We had some insightful topics for Season 1 together with Dr. Lawrence Yu and Dr. Erling Dumagin, and they talked about colorectal cancer, liver problems, and gastrointestinal problems. Now we are back for more health topics, this time from a doctor specializing in dermatology. I got you interested there. But before we head over to our talk, let's watch this video about the hospital at Maayong Aesthetic Institute. The hospital at Maayong Aesthetic Institute prides itself on providing the most advanced surgical, non-surgical, and cosmetic procedures for all ages and all skin types. Their internationally trained surgeons and staff are committed to help you achieve your desired aesthetic appearance from head to toe. The hospital at Maayong Aesthetic Institute is looking forward to addressing your medical, surgical, and cosmetic needs at the premise of their private and luxe setting. Their services include dermatology, plastic surgery, aesthetic, and cosmetic treatments for the face and body. So if you're planning to get treatments for your face and body, head over today at the hospital at Maayo. Their long list of services under their Aesthetic Institute makes me excited to know more about dermatology and learn from our guest doctor today. For today's episode, we will be talking about certain topic everyone can relate, and that is basic skincare. I told you you'll be interested. Now, there is a wide range of skincare products available, and sometimes it can be confusing to decide which product are truly helpful and effective, right? Our talk today will discuss skincare that works for all ages and how to choose products that are right for your skin needs. But before we head over to our discussion, let me introduce to you our guest doctor for this episode of Maayong Adlaw Doc. A fellow of the Philippine Dermatological Society, she obtained her medical degree from Cebu Institute of Medicine, graduating second in class ranking, and completed her training in dermatology from Jose R. Reyes Memorial Medical Center, where she served as the chief resident in her final year. Her interest in research led her to the Johns Hopkins University School of Medicine, where she completed her fellowship in cutaneous translational research. In addition to her private practice, she is an assistant professor at the Cebu Institute of Medicine, as well as the deputy editor for the Journal of the Philippine Dermatological Society. Let us welcome our guest for this episode, Dr. Hester Lim. Maayong Adlaw Doc, how are you?
I'm good. How are you, Miss Priya?
I'm really good. I'm actually excited to be back with CDN, and now I'm with you. Look at you. Now, this is really great. I'm so glad to be doing this first episode for the Season 2 of Maayong Adlaw Doc. And I'm together with this fabulous doctor, our beautiful dermatologist, Dr. Hester. Doc, how are you? It's the summertime. People are busy going out.
Yeah.
So how busy are the dermatologists nowadays?
So speaking for myself, I can't speak for the other dermatologists, but I will say that we've been getting a lot of people who are getting heavily tanned from the beach, jellyfish stings, and of course everyone also just wants to look good. We've been getting a lot of visits to the aesthetic center for people who want to look good, get themselves beach ready for.
You see, other than people nowadays wanting to look super sexy, they also want to show off their skin, right? So I'm sure you get a lot of visits from people. What are the most popular routine that you give them, things like that? We're going to talk about more of that later. I am actually guilty of going to the beach without wearing some protection, so so skincare. Sige, how difficult really is skincare? Because you see, people, they start with something for a while, they continue, and then they stop. Probably because they find it so puti. Is that? Yeah,
Yes.
right? There's so many things to put on your skin.
how difficult really is skincare? How simple is it? Is it supposed to be simple?
So the whole point of this is I want to emphasize how simple skincare can be, and that skincare should really be for everyone, regardless of your age, regardless of your gender, regardless of how much sun you get, for example. So for skincare, there's a lot of traction on social media. You see so many steps out there. There's like the 10-step skincare regimen, and I'll have patients say, Doc, I'm afraid to go to a dermatologist because I'm worried you're going to send me home with like this long list of things to do, and I honestly don't have the time.
And also, I just want, before I forget, I keep on forgetting things. There are so many skincare regimens. One of the most popular nowadays is the Korean skincare.
Yes.
Yeah, we'd like to know more about that also. So probably you can include that in your discussion.
Yes, so I'll be discussing about how to keep it as simple as possible, because what is most important with skincare is being consistent about it. So if you have a 10-step regimen, exactly what you said, Miss Priya, some people will follow it for the summer. Like, okay, I'm breaking out now, I have to be extra good with my skincare, and then they'll stop after a while. So you want a regimen that you can continue until you're 80 years old, 90 years old, because the best products don't work if you don't put them on regularly.
So you mean to say that there's no such thing as too late, or is there something as too late for not starting to take care of your skin? Because I've reached this age and I need to take good care of my skin.
I will say there's no such thing as too late. So with this talk, we really want to emphasize again, anyone can begin a good skincare regimen. Of course, it's better when we start early. Usually, getting the kids used to moisturizers, because of us as Filipinos, we tend to complain, but it's too sticky, my daughter doesn't like it. So it's good to start them early, but there's no such thing as too late.
Okay. Now, question. This, going back to those Korean products, okay, and other products as well, no? Are they really effective? Do we really need to use all of them? All those 10 items every night? Seriously?
So honestly, personally speaking, I would say I have normal to combination skin. That means it's not too sensitive. But again, I don't do anything in terms of like multiple steps. Sometimes these steps can be redundant. For people who are sensitive, the steps can lead to over cleansing, and can lead to irritation and skin dryness. Sometimes all the added oils might not work for you if you're acne prone, and then it can lead to a breakout, for example. So there's no one size fits all with very complicated regimens. But with the simple ones, these are things that we can build up on, depending on your skin type.
Which means that these products, they come in sets of 10.
Yes.
It doesn't, you've mentioned now, no one size fits all thing. So it means that you still have to really visit your dermatologist before using them.
Yes.
Right? Because not everybody is, in Tagalog, hiyang.
Yes,
right?
That's the word I heard so much in Manila. And as a Cebuano who was very poor with Tagalog, I really had to check my dictionary. Ano bang ibig sabihin ng hiyang? But definitely, that's a really accurate assessment, because again, a lot of patients, you see a lot of sensitive skin patients coming into clinic because they tried too many things, they overdid it. They tried products that their friends said, oh, this works for me, you should use it. And then it leads to problems for them down the road. So the safest bet, especially if you're not sure, is, talk to your friendly neighborhood dermatologist.
That's right.
And we're always happy to give advice.
There's another one, I remember. One that's making a rave also nowadays, Retinol.
Yes.
Can you say something about that before we proceed actually to the basic?
I know. I'm getting really into this conversation. So retinols are great products, okay? Retinols are what I often call dermatologists' dream drugs, in that they actually do a lot for the skin. They're anti-aging, they're anti-acne, and they're effective in a lot of other dermatologic conditions. But that being said, you have different types. You have your medical grade ones that require a doctor's prescription. And then of course you'll see stuff in the supermarket that contains, a lot of these over-the-counter, milder or watered-down versions of retinols. And these can still be effective, but of course with retinols, they're being so effective also means that they make you a bit more sensitive to sun exposure. So anyone using a retinol has to remember they don't forget to put on the sunscreen in the morning. especially if you're using it and you're getting a lot of sun.
Okay, so you, as much as possible, is it advisable to use retinols during nighttime instead of daytime?
So
Yes.
definitely most retinols, you'll see them labeled as night creams when they're over the counter, right? And most of these are like anti-aging retinol containing night creams because retinols tend to be less effective in sunlight. It's the sunlight that actually deactivates them or leads to less effective.
What did you call that again? Retinols are your
Dream drug.
dream drug
Dream
for
drug.
dermatologists.
Yes.
But that does not mean also that everybody is young to retinols, right? Others are also sensitive
Yes.
with retinol.
Yes, and so again, it just brings us back to that point where if you're not sure or if you've already had sensitive skin, like there are people who, as children, have had dry skin issues, who say they're not young to a lot of things, and I would say don't experiment with these products. You should really talk to your dermatologist first because even over-the-counter things can still lead to irritation.
Yes, I'm asking about retinol, doc, because there's this, like when you scan through Facebook and then you see everybody selling retinol nowadays, and when you click on it, they message you right away and they sell you the product. And you keep on telling them, I have to consult my dermatologist first. And they keep on insisting, no, it's okay, this is safe. But of course, they're just saying that to sell their product.
Yeah.
So we just want to reiterate that even if it's a dream drug, it does not mean that everybody is young with it. Okay?
Yes, and skin safety is really important. So there's a lot of online stuff, and honestly, it's marketing, right?
Mm-hmm.
So because there's so much, and especially I feel like the Facebook algorithms really just get you, right? For females of a certain age, you're bombarded
right.
with
They're so
makeup,
smart.
skincare products. Everything shows up on your feed, and so you have to just be extra cautious again with these over-the-counter products.
Mm-hmm.
Make sure they're properly labeled and that you know what the active ingredients are, because sometimes these may actually have like medical grade products and then it's not being prescribed by a physician, which ideally would be the case.
Yes. And so, since we've talked about these different regimens, retinols, let's just go to the basic this time, okay? What is a good skincare regimen, okay? What does that include? The very basic ones, something that everybody actually needs.
So I think the most basic, and I would say the backbone of all skincare regimens would be 3 simple steps. And that is cleansing, moisturizing, and protecting with sunscreen. So I like to look at you when I say sunscreen,
yes.
just to remind you. But cleansing is a very important first step, and the whole role of a cleanser is really just to remove surface impurities. So I think as Filipinos, we love getting a good bubble on. We love the detergents. We love saying like the soap foams, and that way I
We
feel
feel like the soap is working if it's sunsy.
Yes,
right?
exactly. And so, with cleansers, we have to realize that it's not intended to be like a laundry detergent. We're not getting rid of all of the grease on your skin because your skin does need surface moisture to maintain the skin barrier. And so I think that's the thing we may get wrong about cleansers a lot is we try to look for harsher products because we think we're not clean enough, when essentially cleansers are really just supposed to remove, things that accumulate throughout the day, like the dust, from walking around outside, maybe extra sebum or oil that accumulates throughout the day. So that's step one.
So follow up to that. Part of cleansing is actually exfoliating, right? Is it important to exfoliate every day? Or these products I've tried, I don't remember really the name. Of course, I'm not supposed to say the name, right? But I have this Japanese product where when you put that on your skin, it's like it gets rid of your dead skin cells. Are those really effective or are they just scams?
So I think I know which product you're talking about. I've also tried it as well. When we talk about exfoliating, there's actually 2 types. There are mechanical exfoliants. So I think many of us have tried it before, like the ones that feel sandy or gritty, for example. And with mechanical exfoliants, we really want to limit overdoing it because sometimes we think, I can exfoliate every day, but that's not the case, especially if you have sensitive skin. So for exfoliation, I would say limit it to once or twice a week at most. And then with a chemical exfoliant, These are your glycolic acids, salicylic acids, where we remove the upper surface but using a chemical instead of scrubbing it off. And these can be a little bit more gentle, but again, it depends on your skin type, right? So if you're sensitive, you might get irritation from these products, and it's always good, again, practice skin safety, talk to a dermatologist.
Okay, so let's go back to cleansing again. When you use soap, okay, you said that it doesn't really need to be like squeaky clean. We just have to get rid of the extra sebum and stuff. What could be good soaps? Without mentioning brands, what could be good soaps? What could be good cleansers for the body, for the face, that we can actually use every day? What are the active ingredients that we need to look out for?
Yeah, so very good question. And we'll get a little bit into the semantics of, what is a soap and what is a cleanser.
Okay.
So probably if anyone has seen a dermatologist, you'll see that there are specific things we prescribe. We tend to say cleansers rather than soaps because traditionally soaps are very harsh. And when we say harsh, that means the pH is very high or alkaline. If you remember from like all the commercials out there, the skin pH is generally between 5 or 6. That means our skin is a little bit acidic. And that acidity in the skin keeps it healthy. So if we're using products like, let's say, a laundry detergent or the product that we use to remove the grease from the dishes, right? Which we are guilty of sometimes washing our hands with dishwashing soaps. Yes, these surfactants. These can be very drying to the skin. So we want products that, again, we prefer ones that don't foam too much, they don't bubble. As you said, they're not so sudsy. We don't really need squeaky clean. And if you are sensitive, you're going to want products that are fragrance-free. Just because, added fragrances, while we love them, aromatherapy and all that, added fragrances can be potential sources of allergy for people.
It could be irritants, right?
Yes, definitely. So we want to be careful with that. Look for the pH, and you'll really see it on the labels of these different, products on the
What
market.
pH was that again we're looking for, Doc?
So we're looking for a pH of between 5 to 6. That way the cleanser matches the pH of the skin. Yes.
Okay. So it doesn't matter whether it's soap or these liquid cleansers, right? As long as you read the labels, it should be between 5 to 6 pH, and active ingredients would be?
So when we look at the soaps, we might not need to see specific active ingredients.
Okay.
Usually those are like medicated soaps. But you would like to see whether we have something called a synthetic detergent. These are milder bar soaps rather than the traditional bar soaps that have a very high pH. So you might want something that's what we call a syndet or synthetic detergent.
All right. So nowadays, some people really want to use strong fragrance soaps, right? Okay, so what you're trying to say is, as much as possible, let's avoid those, right?
Especially if you're sensitive. So there are some people now who can go their entire lives like heavily fragrance products, nothing happens. So it's really a person-to-person basis. But those who are sensitive, and you'll know that you've had a history of sensitivity to products, you might have a family history of asthma, that might mean you're more sensitive.
I'm actually very guilty of that. My dermatologist keep on telling me, please do not use fragrance products, but I cannot help it. They just smell so good.
And that's aromatherapy.
Don't you just love that?
It's soothing and it's calming. So I understand. So I try not to be so general, but a lot of the time when I see patients come in, most of them tend to be sensitive. So to stay on the safe side, we say go for fragrance-free. Products that don't have additional coloring, even. That there's a lot of ingredients.
I feel like I'm one probably of the most stubborn patients in my dermatologist.
It's a common thing because the skin is such an accessible organ, so you're not going to have patients who self-medicate with high blood pressure medications frequently, but with skincare products, everyone sort of self-medicate, so it's very frequent that we see this.
Yeah, okay. Now we're done with cleansing. Let's proceed to the next step. You mentioned there are a few steps. So first is cleansing, next is?
The next step is moisturizing. So moisturizing is also very important. And I know we hear a lot in the media, like should we moisturize or not? But moisturizing is an essential step because sometimes, no matter how good your cleanser is, it can indiscriminately remove, the moisture that our skin needs to remain intact. Yes. So sometimes the cleansers can accidentally be harsh. You know, in the pandemic, we over cleanse, right? We're washing our hands like every how many minutes. We're spraying alcohol here and there, and so the skin can get dry and angry and irritated.
Angry.
Really angry, right? Because it's red, you know. So that's why moisturizing is such an essential step, where we are replenishing that barrier, because you know we take our skin for granted. We take healthy skin for granted, when in fact healthy skin really is, you know, an immune organ. So our skin protects us from bacteria. It protects us from a lot of external irritants, and so we want it to be as intact as possible, and we keep that intact by maintaining, moisturizing.
Somebody told me once that to stay young, you just have to moisturize. Is that true?
That's a very wise person. And I would say, you know, yes, you know, we may have experienced this before. We bought an over-the-counter product and then we used it, and then the next day we say, it's really working, my skin looks so good. And the benefit from that is not from the you know, anti-aging effect of the product, but it's actually because the product probably has a good moisturizer. So the immediate effects we see from using products are actually the moisturizing benefit. So for people who don't regularly moisturize, you know, just try it. Find a product your skin likes, which is also important. You know, if you are...
What do we mean when we say our skin likes? Aren't they all the same? Sticky, icky?
So it's such a negative view of moisturizers.
Sorry, I hate products.
We're trying to make it appetizing for everyone. So when I say your skin likes, it really depends on your skin type, right? So if you're oily, you are going to feel like, oh, this is too heavy or it's too sticky. If you're dry, you're going to say, maybe this product is too light, my skin still looks very dry. So you have to choose a product according to your skin type. And of course, you know, we're very fortunate in the market. Again, you know, if you just go to any grocery store aisle, you know, there's so many options out there. And so if you're oily, maybe you look for lighter weight products so that they feel less icky, less sticky, right? There are gel products as well out there. If you are sensitive or if you're very dry, of course, you're going to have to use something that's a little heavier. You might want a cream, for example. And for those who are even super dry, like for example, the lips can get very dry. Petroleum jelly, you know, so this is still a moisturizer, but it's the heaviest of them all. And so I like to use it sparingly and maybe over extra dry spots.
How often do we have to moisturize in a day? Like when we say moisturize, I'm talking about the face, including the body.
Yes.
How often do we need to do that?
So the general recommendation for moisturizing is once to twice a day. So for me, I like to tell my patients, maybe after your shower, we practice what we call the 3-minute rule, which is when immediately after your bath, while your skin is still moist, you can pat dry, but your skin isn't still fully dry.
Still damp a bit.
Yes, damp. You put the moisturizer on, and then it's much more effective that way. It's because the moisturizer works off of the little bit of water in there. So we have
it's absorbed.
Yes. So it absorbs, so it makes it much more effective in that way. And so, you know, there's a lot we can do with different types of moisturizers. We use them frequently and, as I said, consistently. If you are on a special regimen, let's say your dermatologist prescribed a retinol or you're using an anti-acne medication, you might want to moisturize more regularly because sometimes these can dry you out a little bit more. So those are other things.
I don't use retinol because it dries my skin more and I don't moisturize more.
So there's so much we're unpacking.
So I'm sure Doc Hester right now is looking at me, that's how your skin looks like because you never moisturize.
No, but I will say moisturizing you reap so many benefits from moisturizing.
Yeah, okay. Now, how about the 3-minute rule you mentioned? How about taking a bath or taking a shower and then right after that you put that light oil? Is that okay too?
So it depends also on the product, but we do prefer the standard lotions. Some oils might not be as effective in moisturizing as others. It depends on the chemical construction of the oil.
Aren't they more oily?
But they are oilier. So you have to see, like, does it sink into the skin to provide the benefit you need? VCO, there's a lot of research for VCO, and you know, of course, that's quite, you know, it's very available here in the Philippines. So there's a lot of benefit benefits for that as a moisturizer as well. But of course, we also talk about tolerability where, would my patients want me to prescribe VCO because they might find it sticky? And that's why I always say the best product will not work unless you like it. So there's a lot of formulations out there that you just have to try on and see if it works for you. And if you like it, it's something you want to do.
So how does one know actually if her skin is too dry or it's oily? Like you mentioned that you have to choose the right moisturizer for you, right? So that you can continue it and not stop at a given certain time because you don't like the feel of your lotion.
Yes.
Okay. How do you know what skin type are you?
So you can really assess in the mirror. I mean, the three basics would be you have very dry or sensitive skin, you have oily skin that may or may not be acne prone, and then of course you have combination skin. So combination skin is maybe you have parts of your face that are a little oilier, maybe like the T-zone where we have the most number of oil glands, and then you have parts of the skin that may be a little bit dry. So combination skin tends to be more frequently seen, but we do have patients who just really complain about dry, sensitive skin where they feel like I see a lot of scaling when I put products on.
That's me.
It stings. Yeah, they sting. They lead to dryness, right? So with sensitive skin, we have to be a little more cautious about the products we're using. We have to introduce them slowly. And then for those who are oily, sometimes products don't work as well because they really have to go through the oil. And so we might be giving a cleanser, for example, that's slightly more foaming just to get rid of that extra
Because there's
oil.
already a barrier, right?
Yes,
You have to get through that barrier first.
Yeah, so there's actually like this whole list of 16 different skin types. I won't go into all of them, but some people with oily skin are called
16? Did I hear that right?
Yes.
Okay.
So a lot of combinations.
And we only know 3, right?
Yes. So it's the Bowman skin typing, and we're not going to go into in depth, but some people with oily skin are very resistant. That means they can put products on, they don't get irritated, but then they don't get the benefits as quickly as those who are sensitive. But then some people with oily skin can still be sensitive. So you can actually have a lot of overlap.
Combinations, right?
Yeah.
So combination skin doesn't only mean like oily on the T-zone, dry on. There could be so many other combinations of skin.
Multiple.
Yes. All right. Okay. Now, which moisturizer would be better? Like the one with sunscreen, or can we just stay with the moisturizers that are the usual ones? Ordinary lotions. What do you suggest?
That's a great question because again, you're bombarded with so many products in the market. So not all products on the market are going to be great for those with sensitive skin. Again, of course, we have added fragrances, but we have moisturizers that are there just for the pahumot, for the aromatherapy.
Yes.
And then we have we have lotions that are whitening lotions, for example, that contain certain ingredients like kojic acid. And those, again, are not necessarily going to be very friendly or very moisturizing to people who have extra dry skin. But if you do have rather healthy, skin where you don't tend to get a lot of problems with, over-the-counter products, you can really try whatever is available. But when you see dermatologists, you might notice they're prescribing very specific brands. And most of these are going to be fragrance-free, color-free, minimal ingredients so that we minimize also that risk for irritation and allergies.
You mentioned lotions with whitening benefits. Do they really work? Because honestly, I've tried almost all of them and nothing happened.
So, I mean, the lotions with a lightening effect do work to some degree. They are using active ingredients. But I always tell my patients, lightening doesn't work if you're getting a lot of sun because your sun is really going to be that main stimulus for pigmentation.
So we're going to be vampires now. We just have to stay out of the sun.
This is my favorite nerdy joke. This is why I say vampires look young forever because the sun ages you, it causes pigmentation. That's why vampires are ageless. I aim to be a vampire.
You have great skin, Doc. I think, you should.
I try.
Exposure to sun, this one, going back to whitening, ones with sunscreen, with whitening products. I've always wondered, I don't really go out under the sun except when we go swimming, but when I drive back, the bin of the car, I feel like sometimes it's not enough and my skin still gets really dark, especially on this area when we drive. So even if it's their tint,
Yes.
how does that work? Do we still need sunscreen for that?
Yes, so your suspicions are exactly right. In fact, the windshield tends to have thicker glass, so we get more, I don't know if it is the windshield, but the one in front, I'm very bad with
yes.
car speed. The windshield will have thicker glass, so you get protection from UVB, which protects you from sunburns, and UVA, which tends to cause more pigmentation. But the side windows, which tend to be much thinner glass, does allow UVA to come through, and so we can still get a tan just from being inside the car.
That's why.
And so in the US, where I think they're maybe not allowed to use very heavy tints, they actually have a lot of UV protective like sleeves that people will wear. Of course, that's also a population that's more sensitive to sun exposure. But for us, we can just put on sunscreen.
So we're going to talk more about sunscreen in the next episode,
Yes.
right? Okay. So, what else? After moisturizing, what's another step? Do we have another step?
So
Basic?
Yeah, so the third step actually after moisturizing is, putting on the sunscreen. And, we said we'd talk about it. We sort of dipped our toes into the sunscreen pool today. But yeah, it's a topic I'm really excited to look into.
Okay. Now, you mentioned earlier, right, na there's no perfect or there's no right age for moisturizing. You just have to moisturize as early as possible. What happens if you start moisturizing at around 45 years old?
That's a very
How is
specific
it going
question.
to affect your skin?
Yeah, so again, we can only reap benefits from moisturizing regularly. So again, it doesn't matter when you start. It's always good to start early, but moisturizing in your 30s or 40s, it's never too late to start a good habit. But I will say, the importance of starting it early, especially for those who worry their babies will have sensitive skin. We've found, and there's a lot of research out there to support this, that if we moisturize babies who are at high risk for forming eczema, we might actually prevent the development of eczema down the road. For families who have kids who suffer with eczema, it's a tough condition.
Yes.
So moisturizing early on, especially in kids, making sure, of course, these moisturizers are allergen-free or hypoallergenic, fragrance-free, color-free. These can really prevent, or possibly prevent the onset of a very debilitating condition down the road.
All right, this time, Doc, can you give us simple enumeration of the most important things that we need to do when it comes to skincare? Do's and don'ts.
Perfect. So number one, and you sort of mentioned this briefly, is keep it simple. You don't need to overcomplicate skincare. Number two, I would say, is be gentle with your skin. It can get irritated, especially if we overdo the cleansing, if we overdo the exfoliations or the active products. And then I would also say is if you have any problems with your skin, feel free to see a board-certified dermatologist. And this is really important. I think with many patients don't understand, dermatologists are trained physicians. We go through pre-med, we go through 4 years of med school, PGI, we have to take our physician's licensure examination, 3 years of training in a board-certified institution, and then we have to get board-certified with an exam, and then we also train even more. So it's many, many years of training, and that's why as dermatologists we can say we truly are the experts. So one of the big don'ts is please don't Dr. Google because it's very,
so
it's a favorite thing, right? Now we like to Google things, and Google is full of expert opinions, which is true, but then it's also full of opinions that might be detrimental to your skincare. So for me, that's a big don't, where we talked about people have different skin types. So don't think that products that work for other people are definitely going to work for you. Yeah, so it's a very individualized thing. And then maybe lastly will be don't forget that your skin is a window into your inner health. So the healthier you are, the better rested you are if you're eating healthy food, your skin is also going to reflect that.
Thank you so much for that, Doc. Now, before we finally end our show, we'd like to ask Dr. Hester to give our wonderful viewers here a final message regarding skincare.
So the final message is really summarizing everything we've been saying today, and that is to emphasize that skincare can be simple, it can be easy, and it can be for everyone. So don't be overwhelmed by it. It should just be a simple habit you do. The way we brush our teeth twice a day, you should be able to, cleanse, moisturize, and put on your sunscreen at least in the morning, and cleanse and moisturize in the evening.
I'm laughing because now I don't have any excuse. I cannot say I don't brush my teeth.
That's exactly why I use that example for my patients because it's so easy. It's just in the mirror. So put the product there in front of you.
Thank you very much, Doc.
Thank you so much.
And that's it for our first episode of Maayong Adlaw, Doc Season 2. And thank you very much, Doc Hester, for that insightful tips on basic skincare. Also, thank you very much everyone for joining us today. Please share this to your friends and family so that they can also learn from this episode. And from their promise of Maayo, which in Cebuano means be well, discover a new healthcare experience in Cebu at the hospital at Maayo. I'm Priya Padilla Releda from CDN Digital, and again, we hope that you learned from today's episode. To know more about the hospital at Maayo, head over to their Facebook page at the Hospital at Maayo or their website at www.thehospitalatmaayo.com or call these numbers below.